Get our bogey there. You can always extend our incision if you need to. Good. Then we're going to head down in a direction toward where your implant site is going to go. Could I get that rake? So we're going to take our little rake here, a little dark claw, subcutaneous. Good. Good. Tim. Let me just extend it just a tiny bit, just get better access here. Good. Okay. Then we're going to get down, head obliquely down to the anterior fascia of the calf. And again, this is about 2.5 to 3.5 inches. Good. Great. I'm just going to invert that to the other side there. Good. And then I'm going to get my, make sure we're nice and dry here.
Dr. Steinbrech, somebody asked, what is the recovery process?
They're going to have, they can walk right out of the surgery. Right? They don't need a walker or crutches because their muscles are all intact. There's going to be some swelling. We want to keep them elevated. He can usually go back to work in a week to 2 weeks, and then he's going to continue to keep it wrapped with 2 bolsters on each side. We'll show you that later. We're going to check on him 5 days to a week, and then he is going to get back to work, get back to the gym in 4 to 6 weeks. Okay, good. So now we're going to do our dissection here. Just going to get down to the anterior fascia there. Good. Good hemostasis there. So there's our anterior fascia. Continue to spread there. And you can see what direction we're going there. Nice and clean. I'll take the Army Navy. Good. And then give me a little bit of local. I'll just put a little bit of local on the fascia. It should be okay, but just be on the safe side. Yeah. Unitas is helping us today. He is a superstar.
We love United.
Brittany, rep from Alpha Aesthetics, is here.
Yep.
She's going to answer everybody's questions.
We have quite a few surgeons in here. So yes, we're using Alpha Aesthetics for the calf implant.
Right. Okay, let's take...
Can they rupture?
No, these are, and we'll show you the implant in a little bit, but these are, I'm making a dry incision here. These are made out of semi-solid. So they're almost, they're a soft, solid, so I'm underneath the fascia right there, and I'm just gently doing a blunt dissection with my finger. It's so easy to do this. Good. Underneath the fascia there, have a beautiful space. Now what we're going to do is do our golden handle dissector right through here. Just get underneath that fascia, and it's all gentle. Gentle, gentle, gentle. Good. And it would, if we need to extend our incision, we will. But right now we're good.
I hear, do we have time for a question?
Yeah, go ahead.
I hear calf implants may need revisions down the line. Is this true or false?
For any implant, it's always
Right.
possible, but if you set yourself up for success, you minimize the chances that that's going to be necessary.
Right.
So that's why we're doing this, make sure that everybody does that. One of the things that can minimize that is by using precise pocket dissection. Don't over resect your pocket. Don't use an implant that's too big for the patient's tissues.
Mm-hmm.
And those are all good things to do.
And always go to a board certified plastic surgeon.
Exactly.
Choose your surgeon wisely.
Exactly. Good. So we're just going to move through the tissues there. Fantastic. Good. I'll take a fresh flap. Good. And we're going to go in one more time. Good. Then I'm going to take the Marcaine. I'm just going to make sure that we get far enough down that pocket. Good. Make sure that we're past our pocket there. So we'll be able to get that in. Good. And then you can custom carve these. These are not gooey. There's no caps on them, so you can actually custom carve them. I'm going to go ahead and get my Marcaine so that sits in there while we custom carve our implant to go in. Good. So this is on a blunt cannula. You can use a fat grafting cannula, or you can use the cannula that you have where you're going to let that in. See, I'm using pressure to make sure that it doesn't come back. This is a 3mm alpha aesthetic fat grafting cannula that you can use, or you can use your tumescent cannula. It's good to have something that isn't sharp, so we just don't stir up any bleeding.
Which one's the Alpha Aesthetics cannula? Awesome.
Right here.
Beautiful.
Nice curve.
That's perfect.
Perfect. Good. And Brittany can tell you all about those. We use those fat grafting for body banking, for the chest, and for the delts, and the glutes. So here's an example of one of our implants. This is actually a carving implant. It's an 8-1. There's a beautiful shape there, and what we're going to do is we're going to make this the size that we're looking for. I'm going to trim it down a little bit so it has appropriate projection. So you can see there are two ways to do it. You can do it by sort of hollowing out your potato like you're using a twice-baked potato. For him, what we're going to do is nice and evenly, we're going to go ahead and custom carve it to bring down the projection just slightly, so it's going to be a nice fit for him. So like I said, there's no gooey middle, so these can actually just be custom carved for the patient. I'm just going to move this off to the side. We're going to move this over, and we're just going to do this in a safe place, always in the middle of your table. And we're going to get this to where we want it to be. Now, sometimes do you do it on the top or do you do it underneath? It depends on what projection you want. Sometimes you want to keep this projection, but you just want to get it closer to the muscle or the bone, and that would be a case where you would sort of hollow out the potato, hollow out the canoe. For this one, if we did that, you'd probably have too much curvature to the implant, and I think it's better to keep the flattener because underneath that gastric is more flat, rather than say a round bone. If we had the submuscular wrapping around the bone, we would hollow out the canoe. But because it's going to be against the muscle, underneath the fascia, it's probably going to be better to just bring down the height of it. So we're going to go ahead and do this, and then we're going to put it back into the triple antibiotic with betadine, and then it will be ready to go in. I think it's going to be a nice fit. He understands that this may not be, he has a massive well-developed, very well-developed calf on the other side. He understands that this is going to be a pop that to increase the size, but he understands the limitation of the skin envelope, and that although this will be an improvement, it won't be a total correction, full correction, because we can't put an implant in that's too tight. So let's get back our triple antibiotic. Good. And we're going to put that back in. Only the surgeon touches this. Good. You're now just going to go ahead and shake and bake that.
Love it.
Fantastic. And then I'm going to do my Father, Son, and Holy Ghost. Right through here, a little betadine there. Good. And then we're going to go ahead and dip our You're going to help me with this. Good. I'm going to go up and do the other one. Good. And so this is teardrop to the bottom of this. Go ahead and hold that. Good. Let me just make sure we're in. We can always expand our pocket if we need to, and we may choose to do that. We may even choose to expand our incision. But first we're going to try this. You can use a Keller funnel if you want to. It's not necessary. I'm just going to toe in just a little bit. Good. And the key thing is you want to make sure it's getting through that fascial incision. So you kind of have to use your mind's eye to make sure it's doing that, because you could be pushing, but you're pushing through the skin, the outer skin envelope, but you're really not pushing it through the inner fascial incision. Wow, look at that.
Wow.
Is that gorgeous?
Smooth.
Look how beautiful
Wow.
that is. It's already in. What was that, 10 minutes?
Wow.
To get that implant in. So you can see under local, you have a patient, and then we actually took our time because we wanted to explain everything, and I really slowed down the process to do this. But you could see you could really get this in. Sometimes it takes me 4 or 5 minutes to get it in. Now, it's not about being fast. We're just saying it's about being efficient. It's a beautiful size, complements the lateral side, and we're getting it closer. But it's the other thing about this is it elongated the muscles, because the muscle mobility was very short here, and we were able to elongate it through here. It looks nice and natural. And now what we're going to do is we're going to start doing our closure. Now, the incision that you make here, it's going to be difficult to fully close that, because now keep in mind that fascial incision is under a little bit of tension. So what we want to do is really we can use some suspension sutures here just to secure it in the pocket. So Unitas is just going to retract the skin here. And I'm just going to put a couple of, John's doing great. John, you're doing great. Good. So we're just
All the way from California.
All the way from California.
Came to see Dr.
So we're
Steinbrech.
just going to make sure we get a leaflet of the fascia there. Good. Now we're going to make sure our implant is all the way in.
That's such a nice implant.
Yeah, isn't it though?
Yep. So smooth.
Good. Come out for 1 second. Good. Okay, so if you can just get your retractor right there. Fantastic. And then we're going to get a little bit of our fascia on the other side. Good. A little bit to secure the implant in position there. Good.
What's that?
What was that?
What's that doing
What's what?
right now?
What he's doing?
Yeah.
He's just he's suturing you up.
Just securing it, the implant.
No, on the other side, I feel like right there.
Oh, that's just, he's just holding the bovie in there.
Oh, okay.
Just clipped on there. Yeah.
Good. So if you pull this too tight, it's actually gonna cheese wire through the fascia. Don't want to do that. So we just pull it so it's secure, but it's not under too much tension. We're gonna cut with a little bit of a tail there. Okay, go ahead. And I'm gonna go back with my triple antibiotic again. Come out. Fantastic. I'll take scissors. Good. I'm going to trim this a little bit shorter. Great. And great. Beautiful. Perfect. And then let's go ahead and take our 2O Vicryl again. One more. I just want to be super sterile about this, so I'm going to just go ahead with our betadine one more time in the area. Good. Fantastic. And then we're going to go ahead and just... So it's 2O Vicryl, 2O Vicryl.
2O Vicryl.
2O Vicryl, 2O Vicryl, 2O monocryl. Does the trick. And I always start from the sides and work my way in. So these are buried, interrupted. Right, just don't want knots to spit, and that'll help us with that. Good.
Dr. Steinbrech,
Yeah.
somebody wants to know if they can do both calves at the same time.
You can do both left and right calf, but not left and right on the same leg. It puts you at risk. It is possible to do. I have done it for people that fly in from the far east. But the problem is you can't put in implants that are as big as you'd want to. And so the strategy is to put in the biggest one that you can of the medial gastroc, and then the biggest one, and then come back 4 months later after the swelling's gone down and the tissues have gone down, and then put in the lateral one. That allows us to get as large of an implant in each of those as is possible, and that helps us to also not put him at risk for problems with implant causing compartment syndrome or anything like that. So if somebody says, hey, I want to be one and done and I want to go back to Tokyo, I'll say I'll do it, but I'm not going to be able to get as large of a result. And usually what they'll do is they get it and they'll elect to come back. Now, a lot of times what I do is I'll put in a bicep implant while I'm doing this, and so I'll do bicep and a medial, and a medial quad implant, and a medial forearm implant or a ventral forearm implant, and then in a series we'll come back in 4 months and do the lateral calf, the lateral quad, the tricep implant to complement the bicep implant, and then the other head of the forearm. So that way, none of those compete with each other. They're all lineal. They're running up and down the arm. They're running up and down the leg, but they don't actually compete with each other in terms of postoperative swelling and postoperative blood supply. The other thing is you can't forget is about the soft tissue. If you put too much pressure on the soft tissue envelope, it could create ischemic tissue, could create some problems with the skin, some bubbling, some superficial epidermolysis, or you could have some skin loss. And that's the other reason why we can't, and I spoke to John, this patient, about that, is we can't put an implant that's too big for the soft tissues.
Okay.
Good. Now let's take the 3.0 Vicryl after this. Good. And then, United, we have our bolsters. Carly's got her bolsters all set up.
Yep.
Okay. And she's got her ace bandage and acrylics. Okay, good. So we have everything all set.
We got our mess also.
Now we took our time to do this to show everybody all the steps, but you can see it doesn't take a lot of time to get this in and get this closed up. Like I said, the patient's under local, so they can go right home. They can walk right out the door carefully. And then when they get home, they're going to elevate their legs on pillows, but this is very doable. A lot of times with calf implants, people have trepidation about, is it going to cause the patient too much swelling? I'm not familiar with how to do this. But you can see that you just get under the fascia, you get in your pocket, how easy the dissection is, and how efficient this can be. There's a learning curve, but as things go, this is something that is not insurmountable in terms of becoming accustomed and quite efficient at being able to do the procedure. Okay, so now I'm going to take my 3.0 Vicryl. We're going to do a running 3.0 Vicryl, running 3.0 monofrill, and then we're going to do mast and Steri-Strips with 1-inch Steri-Strips.
Oh, wow. Dr. Steinbrech, amazing patient testimonial in our live.
Oh, that's great.
Yes, he said Dr. Steinbrech did torso tuck, hockey stick, and body banking on Friday. I had little to no pain, just taking Motrin as needed. He is a true master at his craft.
Great. That's our Friday patient?
Yes, thank you so much.
Hey, he must be calling from Chicago. He's in Chicago doing torso tuck.
Awesome.
Great patient.
I pinned
That's
his
so nice
comment.
of you. So nice of you. We saw him on Saturday. It looks amazing. We're super excited. Everything came together really, really well. I'm going to protect your privacy, sir. I'm not going to say your name, but thank you, Chicago patient, for saying hi. That really means a lot. I
Awesome.
love when our patients, preoperative and postoperative patients, sign in, watch what we're doing, and then spread the love. So that's all
Yes.
good. So what we're doing is just right in the deep dermis with our 3-0 Vicryl. We're going to zip this long. Good. I'm doing the old pinky pull on this baby. Good. And then we'll get the 3-0 monocryl ready to go.
It's ready.
Wow.
Fantastic. Unitas is on top of it. Can I just get you to blot that? That'd be great. There we go. Fantastic. Almost there. Okay, 3-0 monocryl. I'm going to just tie off this knot to itself. Good. A lot of great Chicago patients. We really had a fun week last year. Week. That's on for those Midwestern people, or people from Texas like to go up there sometimes. In Chicago, we're right in the Viagra Triangle, as they say, where we're on North Michigan, right over the water tower. Just south of what used to be called the John Hancock building, now it's 875. We're in the beautiful Neiman Marcus building. It's called Olympic Towers. Gorgeous office, gorgeous view. And then we operate over at 900, which is over by the Four Seasons Hotel, right catty-corner to the Drake. If you know your geography down in Chicago. Here we're going to zip together our monocryl, super excited, and then we're going to have mast cell stair strips all ready to go. I'll take the scissors, please. Fantastic. Leave a little bit.
When do you
Of the
see patient consults in Chicago?
Chicago, we see them on Saturdays because we're like busy in New York and LA, but on Saturdays, once or twice a month. Best thing to do is call either the Chicago office or the New York office or the 800 national all-call and set up an appointment, or you can go right on the website. You can either go on Male Plastic Surgery Chicago.com or just the Male Plastic Surgery, the national site, maleplasticsurgery.com, and you can fill out a contact form, and they will set you up. Or you can always call the office to speak with any of our people. You're going to be talking to Richard, or Josh, or Abe, or Patrick, or Joseph, or Tony, any one of those guys, or anybody else in the office. They will get you sorted. And Ricky. Forgot about Ricky. Ricky's our new patient coordinator. I'm super
Great.
excited to have him on our team. Just finishing up here. And then we're going to get our masks all ready. We're going to zap it on. And then we're going to just go ahead and close. Now he's a unilateral, so we're just going to go right to the dressings. And we'll get Carly in here. She's just outside the OR. Carly's going to come in. Carly, you ready to do the dressings?
Ready.
Now what I like to do is I like to dunk it and come out on the other side, then tie a knot to itself on the skin. So we're going to do a Dunkaroo. People ask where I did my training. I was down at NYU, did general surgery with old-fashioned Dr. Spencer, who's one of the guys that they made the MASH characters based on. At NYU in general surgery, and then I stayed with Dr. McCarthy for plastic and reconstructive surgery. And just had a really great time, and we just went into private practice. Good.
Awesome.
All right, there we're going to cut off the loop.
Wow.
Great. Let's cut that loop. Good.
Beautiful.
Free needle. That's all. Bingo.
So as you guys can see,
Good. And then let's go ahead. Right there. Put on that stereo. And let's go ahead
do
and
you want me to
our
get you,
bolsters.
before you cover it, just a photo so you have it?
Great. We'll get a photo of that. And then give me a marking pen. I'm going to show these guys how to put on our bolsters. So keep in mind, we want in that 3/4 position. Beautiful look. We're going to go ahead and this is where, if this is where your muscle is, you're going to want to put a bolster on this side and a bolster on the inside medially, so that that's going to help lock it in your pocket. All right. Here we go. Carly's going to give us a hand with that. John did absolutely terrific.
It looks great.
I think it's going to be great. So what we're going to do is go ahead and put our bolster. There's one bolster medially, one bolster laterally, and then John, I'm going to have you just bend your knee a little bit. There we go. Good. Excellent. And that's going to come around there. Just want enough pressure to make it secure. Don't want it to be too tight. Cut off blood flow. We're always checking preoperatively and postoperatively our distal pulses. Good. And to prevent swelling, you can actually go all the way down with this if you desire. The next one, we're going to start a little bit higher. Carly's going to lift up his knee. Good. Now we're going to do, at NYU, we used to call this the Hollywood roll. It's got to look pretty. It's got to look perfect. The Hollywood roll. So we're going to lift that up. And we're going to come around here. I think this is going to be a nice result. There you go, from skin to skin and skin to dressing. There's our finished result for calf implantation. As you can see, it's pretty straightforward, and he's going to have a really nice result. Okay?
Beautiful.
Good. Alpha Male Plastic Surgery and Alpha Aesthetics is the name of the company for calf implants, ab implants. Nobody else has them.
Yes.
Studio implants for men and different size for women, or a different different feel, softer feel for a woman. And then biceps, triceps, implants, pec, quads, you name it, we have it all.
Yes.
So this is Dr. Steinbrech. Thank you so much, Brittany.
Thank
Thank
you,
Carly.
Carla.
Thank you, John from LA.
And Unitas.
And thank you, Unitas.
Awesome.